In part 1, we spoke about different patterns. In part 2, we're going to be talking about the morphology of blood vessels. And the morphology of vessels include dots, coils, oval structures. They can be lines, which are straight, serpentine, half-looped or hairpin, curved or comma, or twisted loop vessels. Vessels as red dots. These can be seen both in non-melanocytic and melanocytic lesions. The most common non-melanocytic lesions as vessels as dots are usually squamous cell carcinoma in situ and psoriasis. Let's take a look at some examples. Here we have a squamous cell carcinoma in situ, and it's a pink papule with a scale. Dermoscopically, you see these diffuse vessels as red dots. In this particular case, slightly different pattern. You can see in the contact polarized mode this double-edged thickened rim in diffuse vessels as dots. In near ultraviolet light, you can see it quite prominently. Dermatofibromas, they're usually characterized by focal vessels as dots. In addition, there's this network-like structure at the periphery with this central scar-like depigmentation. In this particular example, it's a melanocytic neoplasm. And this pink lesion has diffuse vessels as red dots in the contact polarized mode. You can see the same pattern in the near ultraviolet light mode, and this is characteristic of a spitzoid neoplasm. In this particular case, you have focal vessels as red dots within this pigmented lesion, and in this type of pattern, it's associated with a melanoma in situ in association with a nevus. Coiled or glomerular vessels. These are tightly coiled vessels similar to renal glomerular capillaries. And here we see in the near ultraviolet light the coiled vessels, and histologically you can see these vessels high up in the papillary dermis. For non-melanocytic lesions, a squamous cell carcinoma in situ, the vessels are either diffuse or clustered, porokeratosis, where the vessels are diffuse, and finally, psoriasis. In this particular example, you have vessels as coils. You can see it much better with the vascular enhancement as well as in the near ultraviolet light. Oval structures. These are red and purple oval structures characteristic of vascular lesions. And this is commonly seen in hemangiomas or angiokeratomas. In this particular case, we have these red oval structures or red clots. They're separated by these whitish areas, which are septa, and this is very characteristic of a hemangioma. An angiokeratoma has a slightly different pattern. It has both purple and red oval structures. It often has this whitish veil as well as septa. Serpentine. These are bright red vessels, sharply in focus, large and small diameter, and the large vessels divide into smaller vessels. And it's very, very high sensitivities and specificities for basal cell carcinoma. Another name for these serpentine branched vessels are arborizing vessels. Here we have an example. Clinically, it's very subtle. With dermoscopy, however, you see some serpentine branched vessels, but you see it so much nicer in the near ultraviolet mode where these vessels are quite prominent. Another example, subtle clinically, you have this milky white area with this serpentine vessel dermoscopically in the contact polarized mode. In the near ultraviolet light, you have this beautiful example of these serpentine branch vessels. And with the vascular enhancer, you see it even more prominently. The differential diagnosis of a neoplasm with serpentine branch vessels is an intradermal nevus. And here we have this pink lesion on the face, also known as a Mishra nevus, where you have serpentine branch vessels, but you can see they're not sharply in focus, and they have this orangish yellowish hue. Thank you for your attention.